There is a disease quietly rising among young people across America and Europe, and most of them don't even realize they are at risk. It does not always begin with dramatic symptoms. It does not always look like the classic image of illness. In fact, many young adults who feel energetic, busy, and productive are already on the path toward it. If you regularly consume sugary drinks, sleep less than 7 hours a night, sit for long periods, or struggle with weight gain around your abdomen, you need to hear this right now. Type 2 diabetes is no longer a condition of the elderly. It is increasingly affecting people in their 20s, 30s, and even teenagers. And the most dangerous part is that it can silently damage the body for years before being diagnosed. Diabetes, in simple terms, is a metabolic disorder in which the body cannot properly regulate blood sugar, also known as glucose. Glucose is the primary source of energy for your cells. After you eat, carbohydrates are broken down into glucose, which enters your bloodstream. Your pancreas then releases a hormone called insulin, which acts like a key, allowing glucose to enter your cells to be used for energy. In type 2 diabetes, the most common form in young adults, the body either becomes resistant to insulin or does not produce enough of it to maintain normal blood sugar levels. According to major health organizations, such as the CDC and the World Health Organization, the prevalence of type 2 diabetes in younger populations has been steadily increasing over the past decades. What makes this especially concerning is that earlier onset often means a longer lifetime exposure to high blood sugar, increasing the risk of serious complications at a younger age. The danger is not just high blood sugar itself. It is the cumulative damage that elevated glucose levels cause to blood vessels, nerves, organs, and the cardiovascular system. To understand why diabetes is so harmful, let's break down the mechanism in a simple cause and effect chain. When you consistently consume more calories, especially refined carbohydrates and sugars, than your body needs, your blood sugar rises frequently and dramatically. In response, your pancreas releases more insulin to keep glucose under control. Over time, your cells become less responsive to insulin. This is called insulin resistance. When insulin resistance develops, your pancreas compensates by producing even more insulin. For a while, this may keep blood sugar within a near normal range. But eventually, the pancreas cannot keep up. Blood sugar levels begin to rise persistently. When glucose remains elevated in the bloodstream, it attaches to proteins in your blood vessels through a process called glycation. This damages the inner lining of the vessels, leading to inflammation and narrowing. Small blood vessels in the eyes can become damaged, increasing the risk of diabetic retinopathy. Nerves, especially in the hands and feet, can be injured, leading to numbness or burning sensations. The kidneys, which filter waste from the blood, are particularly vulnerable to long-term high glucose exposure. Over time, this chain reaction can result in heart disease, stroke, kidney failure, vision loss, and nerve damage. And when diabetes begins at age 25 instead of 65, that damage has decades to accumulate. In the early stages, the warning signs can be subtle and easily dismissed. You may notice that you feel unusually thirsty, even when you're drinking fluids regularly. You may need to urinate more often, especially at night. You might feel persistent fatigue, even after sleeping. Some people experience blurred vision that comes and goes. Others notice slow healing of small cuts or frequent skin infections. Unexplained weight changes can also occur, either weight gain due to insulin resistance or, in more advanced cases, unintended weight loss. The problem is that many young adults attribute these symptoms to stress, overwork, lack of sleep, or simply getting older. Because they are busy building careers or raising families, they may delay medical checkups. Research shows that a significant percentage of people with type 2 diabetes are undiagnosed for years. During that silent period, damage is already happening. So what is driving this rise in diabetes among younger populations? The root causes are multifactorial. Lifestyle is a major factor. Modern diets in Western countries often include high amounts of ultra-processed foods, sugary beverages, refined grains, and excessive portion sizes. Frequent consumption of these foods leads to repeated spikes in blood sugar and insulin. Physical inactivity compounds the problem. Many jobs now involve prolonged sitting, and leisure time is increasingly screen-based. Muscles play a critical role in glucose regulation because they absorb glucose during activity. When physical activity decreases, the body's ability to use glucose efficiently declines. Chronic sleep deprivation also contributes. Studies have shown that insufficient sleep can impair insulin sensitivity and increase appetite-regulating hormones, leading to weight gain and metabolic dysfunction. Stress is another underestimated factor. Persistent stress elevates cortisol levels, which can increase blood sugar and promote abdominal fat accumulation. Genetics also play a role. If you have a parent or sibling with type 2 diabetes, your risk is significantly higher. However, genes load the gun, lifestyle pulls the trigger. Environmental influences, socioeconomic factors, and early childhood nutrition further shape risk. When it comes to treatment, it is important to be realistic and evidence-based. There are several main categories of medications used to manage type 2 diabetes. The first-line medication in many cases is metformin. It works primarily by reducing glucose production in the liver and improving insulin sensitivity. Other classes include SGLT2 inhibitors, which help the kidneys remove excess glucose through urine. GLP-1 receptor agonists, which increase insulin secretion, slow gastric emptying, and can promote weight loss. DPP-4 inhibitors, which help regulate insulin and glucagon levels, and insulin therapy itself, which may be required if the body cannot produce enough insulin. These medications can be highly effective in controlling blood sugar and reducing the risk of complications. Some newer medications have also shown cardiovascular and kidney protective benefits in clinical trials. However, it is critical to understand that medications manage the condition. They do not eliminate the underlying insulin resistance if lifestyle factors remain unchanged. Side effects may include gastrointestinal discomfort, increased urination, risk of low blood sugar with certain drugs, or other medication-specific effects. This is why it is essential to work closely with a qualified healthcare provider and never stop or adjust medication without medical supervision. The encouraging news is that the human body has a remarkable capacity for metabolic improvement, especially in the earlier stages of insulin resistance and prediabetes. Research consistently shows that lifestyle interventions can significantly improve blood sugar control and, in some cases, lead to remission of type 2 diabetes, meaning blood sugar levels return to non-diabetic ranges without medication for a sustained period. However, remission does not mean the disease is cured, and continued healthy habits are essential. Nutrition is foundational. Emphasizing whole foods such as vegetables, legumes, lean proteins, healthy fats, nuts, seeds, and high-fiber carbohydrates can help stabilize blood sugar. Reducing intake of sugary drinks, refined carbohydrates, and ultra-processed snacks is crucial. Portion awareness also matters. Even healthy foods can contribute to excess calorie intake if portions are consistently large. Some individuals benefit from structured dietary approaches such as the Mediterranean diet or other balanced, evidence-supported eating patterns. Regular physical activity is equally powerful. Both aerobic exercise, such as brisk walking, cycling, or swimming, and resistance training improve insulin sensitivity. Muscles act like glucose sponges when they contract. Even short bouts of activity after meals can reduce blood sugar spikes. Sleep should not be neglected. Aim for 7 to 9 hours of quality sleep per night. Establishing a consistent sleep schedule and limiting screen exposure before bed can improve metabolic health. Stress management techniques such as mindfulness, breathing exercises, journaling, or therapy can also reduce cortisol-driven blood sugar elevations. And routine medical checkups, including fasting glucose or HbA1c testing, allow early detection and intervention. Certain groups need to be especially vigilant. If you have a family history of diabetes, you should monitor your metabolic health regularly. Individuals who are overweight or have central obesity, meaning excess fat around the abdomen, are at higher risk. Women with a history of gestational diabetes face increased risk later in life. People with polycystic ovary syndrome, or PCOS, often have insulin resistance and should be screened. Those with high blood pressure or abnormal cholesterol levels should also consider regular blood sugar testing. Additionally, certain ethnic groups, including African American, Hispanic, Native American, South Asian, and Pacific Islander populations, have higher rates of type 2 diabetes according to epidemiological data. If you fall into any of these categories, early and proactive screening is not optional. It is essential. The most important message is this: ignoring early signs does not make them disappear. Diabetes does not develop overnight. It is usually the result of years of gradual metabolic strain. But that also means you have a window of opportunity. Small, consistent changes compound over time. Choosing water instead of soda. Taking a 20-minute walk after dinner. Prioritizing sleep over late-night scrolling. Scheduling that overdue physical exam. These actions may seem simple, but they directly influence insulin sensitivity and long-term risk. At the same time, fear should not be the main motivator. Informed action should be. The goal is not perfection. It is progress. If you have already been diagnosed with type 2 diabetes at a young age, understand that you are not alone, and with proper management, many people live long, healthy lives. Work closely with your physician, registered dietitian, or certified diabetes educator. Monitor your blood sugar as recommended. Take medications as prescribed, and focus on sustainable lifestyle improvements rather than extreme short-term solutions. If you are currently healthy, this is your wake-up call to protect that health. Research continues to show that prevention is more effective and less costly than treating advanced disease. Early screening, especially if you have risk factors, can detect prediabetes, a reversible state in many cases. According to large-scale prevention studies, modest weight loss, even 5 to 7% of body weight, combined with regular physical activity, can dramatically reduce the progression from prediabetes to type 2 diabetes. That is a powerful statistic. It means you do not need to transform your entire life overnight to see meaningful results. Imagine being 30 years old and facing the possibility of heart disease at 45 because of uncontrolled diabetes. Imagine experiencing vision problems in your 40s that could have been prevented. These are not rare stories anymore. They are becoming more common. But the story can also go the other way. Imagine reaching your 50s with strong cardiovascular health because you made intentional changes in your 20s and 30s. Imagine setting an example for your children by modeling balanced eating and regular movement. Your daily decisions today shape your metabolic future. Before making any major changes to your diet, exercise routine, or medication, consult your healthcare provider. Individual needs vary, and what works for one person may not be appropriate for another. Evidence-based guidance is essential, especially if you already have elevated blood sugar or other medical conditions. If this information opened your eyes, don't keep it to yourself. Share it with someone who might need it. And if you want more science-based, practical health content designed to help you take control of your well-being, make sure to subscribe to this channel and turn on notifications. Your health is one of the few investments that truly compounds over time. The earlier you start protecting it, the greater the return. Don't wait for a diagnosis to take action. Start today.